You know, it's very interesting. We're living in a fascinating time, and I'm not sure how many people realize this, but for the first time in 2009, more people died of non-infectious diseases than like diabetes, like heart disease and cancer and problems like that than they did from infectious diseases. And you're going to say, why would I even bring something like that up? This is kind of crazy. We're talking about feet. But what is true, and has always been true, like Auguste Comte said, is that demography is destiny. And what's happening now is that we're leaving this era of disease, and we're entering an era now of decay. And one of the first things to decay is our skin and the bones. And where's that going to happen? It's going to happen in our feet first. And that's why now, if we look at problems like diabetes, why there's an amputation every 20 seconds around the world. If we look at problems like arthritis, we see huge increases in degenerative arthritis and other types of problems like that. If we look at sports-related injuries from people being more and more active as they're living longer, we're seeing more and more complications there. But the one common denominator there is decay. And we, in this space, have an opportunity to make a massive impact on preventing this kind of decay. And so that's why I'm telling you it's an exciting time. And I think we can make a difference in something as pedestrian as an insole. And what we've seen in the past has been that for the last literally 100 years, there has been little done in the way of modifying shoe gear and even insoles. There have been some advances over the last generation, but not until really recently have there been wholesale changes. And I think one of the real exciting things now is that we're starting to see data match with the disease process. And some of the things that we've tried to tweak in this area has been not just to focus on repetitive stress in this direction, repetitive normal stress, but really also shear stress. In many ways, this has been a problem that's been hard to identify because it's hard to measure in shoes, it's hard to measure in real life. It's easier to measure in the laboratory. But what we know as clinicians is that when we see a callus, when we see a wound or other problems like that, we know it's there. We know it's playing a role. It's a little bit like dark matter in the universe. It's a problem that's hard to measure, but we think it probably takes up a lot of mass in the universe. And we think that's what's happening now with shear and the foot and other parts of the body as well, which is why we've made this big push, and which is why I have really focused quite a lot of attention on not just vertical stress, but shear stress. And now, thankfully, and thanks to the people at Vasyli, I think they have really embraced this idea in moving forward toward shear modulating technologies. In other words, laminating two different viscoelastic substances over something that's a little bit more slick in a way that we can modulate shear just enough to modulate it and mitigate it, not too much that you slide like sliding on ice off into the end of your shoe. And that, looking at various studies, has had a dramatic impact at reducing shear by upwards of 9-fold in benchtop work. And in addition to that, based on randomized controlled study that was funded by the National Institutes of Health in the United States, we saw a reduction in wounds for the first time with any insole in people with diabetes at the highest risk. So if we're dealing with the most sensitive patients, people with diabetes, people with arthritis, people with other kinds of pain, both painless and painful problems, I think that modulating not only vertical stress, but shear stress is probably going to make a really big difference in their lives.